Hello, everyone, and thank you for joining us today for the next presentation in our series of webinar forums on managing stress. This is a joint production of the Department of Psychiatry, the University of Iowa Hospitals and Clinics COPE team, and the University of Iowa Employee Assistance Program. I'm your facilitator, not Dr. Laura Fuller from the Department of Psychiatry, but Sam Mitchell, Program Coordinator for the Office of the Chief Medical Officer. Before we start, I have some important information to share about this program. This webinar is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. If you think you have a medical emergency, call 911 or go to the nearest emergency room immediately. No provider-patient relationship is created by this webinar or its use. Neither the University of Iowa nor its employees nor any contributor to this webinar makes any representations or warranties express or implied with respect to the information provided herein or its use. All right, let's get going. We're excited to have you join us today. You might notice that things are looking slightly different. Our forums have transitioned to a recorded format, and we will be coming to you every Thursday at noon. A list of the scheduled presentations is available through the Noon News and the Loop. There you will also find a survey link to ask questions in advance if you would like. These changes come as we are transitioning back to working on site, so today's topic is especially timely. You may recognize our presenter, Dr. Laura Fuller from the Department of Psychiatry. She's here today to present on reintegration, getting back in the swing of things. Here to tell you more without further ado is Dr. Laura Fuller.
Thank you, Sam, for that wonderful introduction. I'm excited to be here today and talking about something that I have been experiencing myself and that I would like to help as many other people with as possible. So I'm going to talk about reintegration and COVID-19 and getting back into the swing of things. I know that some people have been working at a breakneck pace at the UIHC or elsewhere during this whole pandemic, while others have been working from home, experiencing a slower pace, or working from home and trying to do everything. Others have had temporary reassignments, layoffs, loss of work, or any number of other things. I also know that what you've experienced during the past 2 months, no matter what it is, you have had a lot of adjusting to do and a lot of pivoting, not just in terms of work, but emotionally, psychologically, and relationally. Finally, I know that there are some people who were or are very scared or stressed about coming back to work. I'm going to talk today about some ideas that may be helpful if the reality you are facing is that you will be returning to your workplace after doing something different for a while. These ideas can also be useful for others since the situation is changing constantly, even for those who have been coming to the hospital every day throughout this time for work. On a personal note, I want to share that for a time in March, I was terrified. I'm feeling a lot better now, but for a while I was terrified. Looking back, I was worried that I was going to bring COVID-19 home to my family or pass it to my parents who are in their 80s. This was at its worst when I took a road trip in late March to help some loved ones drive back to Iowa from where they were spending a few months in California during the winter, as many older people do. This trip involved driving from Iowa to western New Mexico in one day and then back over 2 more days. During the height of my anxiety, I was convinced that I had a mild, nearly asymptomatic case of COVID, and I would lie awake at night wondering when my symptoms would progress to the point where I would need to go into the hospital for intensive care, or when I would get a call from a family member letting me know that they were critically ill. It sounds silly to me when I say it now, but that was my reality at the time. Things got better gradually as I worked from home for about a month during the time that I was not able to see patients in person. Then my fears got reactivated when I learned that I would be called back into the hospital for some mental health de-escalation shifts. Although I was very scared, my rational mind was telling me that things were going to be okay and that the work I was being asked to do was very important and necessary. So I spent some time wrestling and coping with my fears to figure out how to get back in the game. I know that a lot of people have had fears like this to a greater or lesser extent during this pandemic, and it is nice to know that I'm not alone. This means that while some people are totally fine or even eager to head back to work, despite the fact that the pandemic is not over, there are some people who are quite anxious about coming back. And I hope that this presentation is helpful to the still anxious folks in particular, and to the rest of you as well. So, something that people who know me well already know about me, but most of you probably don't, is that I really enjoy music, and I often get songs or lyrics stuck in my head. As I was preparing for this talk, I had several songs or lyrics that I'm going to share with you to get started. At the risk of dating myself, here are 3 of them. One is The Grateful Dead. What a long, strange trip it's been. That's a lyric from the song Truckin', and it's a true Deadhead mantra. And it sure has felt like a long, strange trip as we've been moving through this COVID situation. Another one is, I don't know if you can see this, this is Aerosmith's greatest hits, and the song Back in the Saddle. Perhaps you can hear Steven Tyler saying, "I'm back," as I'm showing you this album. The third one is REM's It's the End of the World as We Know It. I don't know what Michael Stipe and the boys intended when they wrote this originally, but as I reimagine it for COVID-19, the world as we know it has ended. It's a transition, like many that we've been through in our lives, the end of the world as we know it, but not the end. Having a major surgery, starting or ending a significant relationship, moving, starting a new job, and retiring are all big changes that we can and do go through in life. These transitions can be full of uncertainty, and they may feel like the end of the world as we know it, but also a beginning. And remember, the rest of the title from this song is that it's the end of the world as we know it, and I feel fine. That's my hope for all of us as we are transitioning back to work or whatever life has in store for us. I hope that overall you will feel fine. And if not fine, then okay and supported. So, I imagine that people who are watching this are looking for some ideas. I want to give you some ideas for people who are heading back to work, or who have recently headed back into the workplace, or who are anticipating transitions in the future, such as kids going back to daycare or school in the fall, maybe, or whatever else. So I have a slide that has some information about this as I talk. Here are some ideas for reintegration to work. As you get ready to head back, if you haven't yet and you're getting ready to, acknowledge your concerns. Some people are anxious about getting sick or getting others sick, like I was in March. Some are worried about their kids or money or the uncertainty of what things will be like. They may wonder if someone else has been covering for them. They may wonder what the state of things will be when they get back. It may help to just say what you're concerned about to yourself or maybe to someone else. Putting words on something, saying it out loud, or just saying it to yourself can actually make it seem less threatening. The next suggestion is to put things in perspective. For example, thinking about the actual risk of getting sick for people who are wearing proper protective equipment and doing regular hand hygiene, etc., may be a reassuring thought. Or thinking about all the people who have been coming to work throughout the crisis who've stayed well. I personally look at the numbers that come through on our emails each day as we get COVID updates, and I notice that there haven't been a lot of new illnesses. I pay attention to those things and find them reassuring. Another suggestion is to get information. As you're getting ready to go back to work, read up on what's happening at the hospital or in your department. Check out those emails. Most departments are giving out a lot of information. It may be a little overwhelming sometimes, but there is a lot of information, and it might be helpful to prepare by looking it over before you go back in. So inform yourself about the current policies and procedures and protective measures that are happening at your workplace. If you are a UIHC employee, these things are easily accessed on the loop. Finding out what things are like in the workplace can be very helpful, so you know what to expect. Additional suggestions: as you get ready to head back, picture it in your mind. Think about what it will be like going back to your workplace. Imagine yourself wearing your protective equipment and walking through the screening station and walking into the door of your clinic or office or workspace. And imagine doing what you do at work. If you've been especially anxious, you might even want to break the glass ahead of time and plan a brief visit to your workplace to help manage your anxiety before you return for a shift, if this is permissible and makes sense for you. The next idea is to communicate with colleagues and family. If appropriate, communicate with colleagues about plans, find out what things will be like, and learn what the plan is. Talk to your family about your plans for returning to work. And then prepare. It can help to leave a little extra time in the morning so that you are not in a rush on your first days back, or even beyond that, to make sure that you have all your essentials, PPE, food, water, etc. Also make sure to have a plan for when you re-enter your home. So I get in the morning my work bag ready. I make sure that I have my face shield in my car. All those things I try to make sure to have ready ahead of time so that I don't feel rushed in the morning, because if I'm already stressed about returning to work, then worrying about having the right stuff is even more stressful. Okay, as you transition back, accept that everybody's experience is unique. As you're seeing your coworkers again in person, perhaps, it may seem to you like some people have had a lot easier of a time than you have, but it's hard to know that for sure. So I would encourage all of us not to get too judgy about someone who seems like they've had it really easy. And I would encourage everyone to just accept that we can't know how heavy somebody else's burden has been. Check in with yourself during the day. Take breaks for food and hydration, especially if you're working a full shift. Take stretch breaks. We're actually having a wellness forum on this very topic in the near future. I also recently heard a suggestion that I loved. While you're washing your hands for those 20 seconds, also taking 5 deep breaths to de-stress. Sometimes those little things can be a good way to check in with yourself and to let go of stress that you're carrying. Reconnecting is another way to help yourself as you go back to work or as you continue in your job. Get in touch with your coworkers. There may not be time for this in person during your shift. It can be done by other means and over time as well. Seeing a friendly face at work or getting a load of each other in our protective gear can bring a smile. I have gotten a kick out of seeing other people sometimes in their face shields and face masks. Some people have very clever masks that they're wearing. And sometimes I also kind of laugh at myself, especially the first time I wore my face shield. I was not wearing it right. It was askew. My hair was way up. It was very funny to me when I saw myself. Also make sure to connect with your support system outside of work if you haven't so far. make a point to stay in touch with people. As you're back or transitioning back, find ways to make things a little easier on yourself at the start. There are a lot of options here. If you have a spouse or partner who is not yet super busy, maybe they could drop you off at work instead of your usual walk or bus ride from the parking lot. Or perhaps they could bring you food during your break. Don't overcommit in other areas while you're getting back in the swing of things at work. Leave time for you. If you typically cook dinner after a day shift back, half a year ago, that's what you did. Another idea might be to grab a takeout meal or a pre-made meal on your first evenings back to work. As you're adjusting to this new schedule, it can be very helpful to not press yourself to do everything or go right back to how things were in the past. Healthy habits is another really important suggestion. You've heard it a lot, and it remains really important. Make sure to observe good overall protective practices. Eat healthfully, sleep as well as you can, sleep enough, get exercise, limit or avoid substance use, make sure you have social support. And continue to be judicious about exposing yourself to information about COVID-19. Don't spend too much time reading scary articles and things like that. It's good to stay informed, but there is such a thing as too much information. Okay, the next slide I have for you is about kids and teens. If you have kids and teens at home, this next part is for you. There's still a lot we don't know about what will or won't be happening for kids and teens during the summer and into the next school year. This is definitely a work in progress and will also depend a lot on your child or children and your specific situation and what happens with the virus over time. So some suggestions would be to talk with them about positives that they may want to hold on to. I'm hearing this from a lot of families, that there have been some silver linings for their families and things that the family wants to remember to keep doing, even when people are going back to work and school and things. So it might be things that family members enjoyed about the time of quarantine, or things that they weren't doing that may not be added back in the future. Find out what those special things were and make a plan, if you can, to continue the things that have been helpful in whatever way they can be maintained. Find out about your family's concerns. Talk to your child or teen and make time to hear what's on their minds. It may not be a time to problem solve or argue. It may just be a time to listen, at least initially, and then you can shift into the problem solving mode a little bit later. Talk to kids about what to expect as parents return to work. As you go back to a different schedule, let them know what your schedule will be and how to reach you and what you expect them to do while you're gone. This could be in the form of lists or Post-its or check-in times throughout the day, or maybe even having someone else, like a grandparent who lives somewhere else, checking in with them. And then talk to kids about what parents are doing to stay safe and well. Some kids really worry about this and worry that parents going back to work will make their parents ill or carry illness to the family. So talk to them about what you're doing and how your workplace is protecting you. Don't give too much information, but reassure them that you are doing everything you can to stay safe and well, and that your employer is also doing things to help people stay safe and well. Also put supports in place for kids if parents are going to be away more. You could just talk through it, or have people who will be watching over your child or children and checking in on them. This all kind of depends on your child's developmental level and other safety concerns, and how many kids you have and where you live, and lots of different things like that. consider regular family meetings or a shared family calendar to enhance communication so people know where other people are and what they have planned, etc. Also, continue to model good self-care and hygiene. Kids pay more attention to what you do than what you say, so make sure you're paying attention to basic hygiene like hand washing and keeping things clean. If you are in a place where you may likely be exposed to virus, then cleaning those things, modeling that for your children as well, and all the other basics that we've already talked about, sleeping well, eating well, etc. And trying to find time each day to be present with your kids, listening, being playful with them. Many families I've heard have played more games or done puzzles together or started watching new shows together. So this may be something to pay attention to in particular as you go back. It might be something that your kids will really miss if it goes away. So, in conclusion, I started with 3 songs and I have one more song to share with you. This is the Eagles' greatest hits, and the song Take It Easy by the Eagles has been going through my head a lot. I want everyone to try and take it as easy as they can while they're reintegrating, although I know that's a tall order sometimes. If you haven't been super anxious about your work, that's wonderful. If you are scared or worried, that's not unusual. There are things you can do to cope. In fact, we've produced over a dozen wellness forums already, featuring ideas for coping, staying well, and managing stress. You will be okay. We'll get through this. And if you don't feel okay right now, there are resources, including the Employee Helpline, the Employee Assistance Program, the hospital's COPE team, and others that are listed on the hospital website, The Loop. Thank you for listening today, and thanks for all that you do. Stay well.
Thank you, Dr. Fuller, for that really great presentation. I do have a couple questions for you. This one is personal because in my own household, we're really wrestling with family members who want to reintegrate faster than others. Do you have any suggestions or advice for how to navigate that type of situation?
That's very common. That's happening with a lot of families, and oftentimes teens in particular are just dying to see their friends. And it is harder to make sure that they're not going out while parents are at work or things like that. I think that listening to them about what it is that they are missing and trying to get them to verbalize what they'd like, and then talking about your concern about keeping not only them, but the family and others safe is the next part, and trying to problem solve some ways that they can have connection, maybe do things a little bit differently, but not go full on, to a large gathering of a whole bunch of people packed tightly together. So this will vary for families. Some families have different tolerance levels than others, and some families honestly have more exposure or risk than others because of whether people are going back to work or where they live or where they have to be at times during the day. So talking about what you'd like your child to do in terms of maybe still, if they go out to a convenience store, for example, and you want them to wear a mask and use hand sanitizer after they've gone there, might be an okay compromise if that seems reasonable to you. That's something we've done at my house. My son really has a craving for Doritos Flamas, and he has agreed to wear a mask and clean his hands after he's gone into the store and wipe down the bag, and that worked for us. There may be other solutions that work for other families, but I think the key really is communication and figuring out what your concerns are and what your child's concerns are.
Yeah, that sounds like a really great compromise. I'm glad you were able to work that out.
Yeah.
So, if somebody's going through trying all your tips and tricks or all the things that we've talked about in past forums for coping, but they just feel like they're still not getting there. But they don't know what to do. What are some situations, or when should somebody think about getting more help?
If someone is having such persistent and severe anxiety, or really, like low mood, thoughts of death or suicide, just a general feeling that they're hopeless or are not going to be able to effectively cope. Those are times when help should be sought. Our employee helpline is actually a great resource, because if you talk to it's manned, staffed 24 hours a day, 7 days a week. If you talk to someone on that helpline, they can help you sort through that if you're a UIHC employee, and you can walk away from that with a referral to see a mental health provider in our hospital. So, and it's confidential. Nobody takes down any information about your name or anything like that. So that's one great resource. The EAP is another great resource, as you know, available to University of Iowa employees and their immediate families. They offer free sessions and referrals. And then there's the COPE team within the hospital, which has been helping with debriefings and talking with employees, having just some check-in sessions with some of the COPE team members. So there are resources out there. And if you're just feeling like you're not going to make it and you've tried all these other things, then it might be time to seek some further help.
Thank you for that. That was the end of our questions. So I just want to thank you, Dr. Fuller. We appreciate you sharing these practical steps to respond to the coronavirus and for reintegrating. I want to let everybody know that additional resources related to this topic are included on the loop. And next time we'll be discussing how the importance of accepting help with Dr. Iyad Hanna. Until then, take care. We look forward to seeing you soon.
Thank you.
Thank you.